It's Jeff again. Um, I should start by saying this is not medical advice at all. I'm not a doctor. Don't play one on TV. Don't pretend to know that much about this, but I do have. I did a bunch of research and I think I have a fairly good understanding of what the VNS implant is and does. I think there's a lot of information out there about VNS for epilepsy and seizures, but there's not much out there for depression. That's why I'm doing this. So, just wanted to give you some of that background information. What is a VNS implant? And what is it supposed to do? So the vagus nerve starts in your brain, goes all the way down to your colon. Apparently, I thought it was the longest nerve in the body, but it's not. It's the longest cranial nerve in the body, meaning coming from your brain, I guess. And information is sent both directions. So your brain sends information to your organs sends information to your brain. And this impacts all of your major organs, your heart, your lungs, your colon, your spleen. It goes all over the place, your intestines. And so it is part of your parasympathetic nervous system. And so that's the rest and digest that is supposedly soothing. And somehow they don't understand the exact mechanism, but that's part of the reason why I'm doing the research study, or why the research study that I'm doing exists, is they're trying to understand exactly how does this work? Why does it work? Because they don't understand the exact mechanism at this juncture. The implant that I have was actually placed a different direction, oriented differently, because the study that I'm in for the VNS, there's a separate study, which is an MRI study. And in order for me to have an MRI while the device is operating, they needed to change the orientation of where the planes are, I guess, something that the surgeon explained to me. It doesn't change anything other than when they go in to change my battery, it will be oriented differently, so they have to be more careful how they cut it out. So yeah, the device that's implanted in my chest sends electrical impulses stimulating the vagus nerve 30 seconds out of every 5 minutes is the standard setting. My research study is going to be playing around with different wattages and strengths of, I don't know, frequencies and wattages or something. So there's a couple of variables that they can do. I'll learn more about that later. But it is on a regular interval. It goes 24/7. It's designed to stimulate, therefore causing changes in, I guess, my parasympathetic nervous system and the reaction. But again, they don't really understand the mechanism of how it works. So VNS was originally approved for epileptic seizures, reducing the severity and or length of seizures, and then they determined that there was advances or benefits to people's mood, so then it became approved for depression, and it also is used more infrequently, but starting to become more popular for stroke recovery. But I think the programming of what they do for stroke recovery is different than what they do for depression, which is different than what they do for seizures. For example, when I have it turned on, the magnet for me will shut off the device temporarily as long as they have the magnet in front of it. For folks that are experiencing seizures, when they put the magnet in front of the device, it actually increases the pulsing. I don't know if it's the intensity or I don't know what it does because it's not part of my realm. So yeah, it's very interesting. There's actually two vagus nerves as well, even though they just refer to it as the vagus nerve. The right one on the right side of your body apparently travels down and goes around your heart and is more sensitive. So they don't use the right side vagus nerve for the VNS implants because it's more prone to increasing or changing heart rhythms and structures or something. So they use the left vagus nerve. When I first heard about this, I was like, Vegas, I love Vegas, but it's not Vegas, it's Vagus, so it's not quite Vegas, but it's Vegas. So that's exciting. I am feeling very similar to the way I was yesterday. My voice still not so good. I think my camera is creeping down. Shrinking. I'm shrinking. Yeah, I don't have any pain or anything. It's just that my voice is impacted. And I don't know how long this is going to last, but hopefully it starts getting better soon because it's kind of hard to talk on the phone and people all want to know what's going on. So anyhow, anything else that I can think of on the VNS implant? I guess it's a little bit bigger than a quarter sized and flat. I can barely feel it, but there's still probably some swelling in there. But I'm expecting that things will grow around it and it won't be very noticeable. At least that's from what I've heard from other people that do have limited information on the internet. There's a lot of other videos about vagus nerve stimulation, but they're external stimulation. People may have heard about massaging your vagus nerve or things that go on the ear or other parts of the body, because the vagus nerve goes so far reaching, you can actually have an impact on the vagus nerve in lots of different places, but the main place for the implanted device is up in your neck. And the external things obviously are less invasive, but probably theoretically less effective, I would think. I don't know. Time will tell. So that's about all for now. I hope that this has helped explain some things. If you have questions, I guess you could always post them. I have no idea how that works, but I'll be figuring that out on this YouTube experiment, I'll call it. So I hope you're having a good day. Thank you. Bye.